Hello, we are talking today about hot and cold therapy. So it is one that gets used in probably every single injury up and down the country. If you injure yourself, there is going to be someone saying whack an ice pack on it, or wrap yourself up warm. You'll keep the muscles warm. So what is the advice that we give out at Black Swan Osteopathy and at Third Space Sports Medicine? Which one do we advise and when? So 99% of the time we will be looking at applying ice. And why do we apply ice? It is a natural painkiller. It takes down the natural inflammation in a really, really localized area, whereas if you're taking any kind of anti-inflammatory drugs, that has a systemic effect, so it will take down inflammation all over the place. So the ice is really, really local. Obviously it's drug free. Anyone can use ice, and you can use it for short periods of time, which makes it nice and easy to administer, and you can keep them at home. And you can even use frozen peas, which have been proven to be pretty effective, as well as crushed ice and things like that. We highly recommend these. They're fabric covered ice packs. They soften really nicely when you take them out of the freezer. The fabric doesn't degrade like the plastic ice packs that you tend to get, so you can use them hundreds if not thousands of times. I haven't actually tested it for thousands of times, but this one in particular has probably been used a few hundred times at best, so at least. So yeah, and the main thing is how to apply the ice pack. Obviously, I've taken this out of the freezer probably 5 minutes ago. It's still really, really cold, but it's got some malleability to it. You want to be applying it straight onto the area that is injured and feeling sore, but it's really important not to apply it directly onto your skin. If I put the ice pack directly onto my arm, there is a risk of me getting a freeze burn to the skin. So make sure you've got a piece of material, a tea towel, t-shirt, anything like that, to apply between the ice pack and the skin. And how long do you leave it for? I would leave an ice pack on for up to 10 minutes, and the advice is generally either leaving it on for 10 minutes and taking it off for 10 minutes and cycling through that for up to an hour, or using an ice pack for 10 minutes every 2 hours. So it depends on how acute the injury is, as to how often you apply the ice pack. There is also some evidence that applying ice immediately after an injury is actually not necessarily the best course of action for a rapid return to sport and recovery. There is some evidence that letting the body's initial natural inflammatory response to an injury is good for the healing process itself. So dampening that down with an ice pack or with ibuprofen is starting to think that possibly that's not the case, but again, the jury's out, so we shall see if that is the case. But yeah, so that is why you would apply an ice pack. Why would you apply heat? Now, certainly in an acute injury, so the first few days after an injury, I would never really suggest applying heat because it increases inflammation into the area, and generally you're in the phase where you want to be lessening that inflammatory response. After that 72-hour period, there is some quite good evidence to suggest that applying some heat alongside some ice, so cycling through those sort of heat ice, starting and ending with the ice, can help flush through. So you're attracting blood to the area that you're applying heat to. That's why your skin goes nice and red. And then when you use the ice, constricts the arterioles and the capillaries in the area, and all that blood leaves, hopefully taking with it a lot of tissue fluid, the inflammatory proteins and everything like that. So you get this nice recovery of the and removal of waste products of any of the cells that are broken down from any kind of trauma. So that is why you would apply heat. If you've woken up with a really, really stiff neck, the best thing in the world that feels like it should work is heat. Because the muscles are so solid and so tight. That is true, but again, in the first 3 days, first 72 hours, please use ice first. You will have a much quicker recovery if you're using ice to improve the movement in your neck. And some of the strategies we used a few weeks ago in our neck stiffness rehab podcast, blogcast, whatever these are, vlogcasts. So do try some of those strategies before you apply heat. And after those 3 days, then yes, cycle heat with some ice, and you should have a really nice recovery. And as always, if you have any questions, please do speak to one of the team in Clapham Junction, Kensington, or in London Bridge, and we will be delighted to help. Thank you.